Hi, everyone. My name is Jenna Scalzitti, the Associate Director of Communications with Boundless Life Sciences Group. I'd love to welcome Dr. Annabelle as our guest speaker to honor National Primary Care Health Week. Welcome, Dr. Anna.
Yeah, sure. Thank you, Jenna, for inviting me. I appreciate the opportunity. I am a general pediatrician in Austin, Texas. I have had a small outpatient office for over 15 years, probably going on 17, and would see infants from the newborn nursery, all the way up until when they're 18 years old and go to college. And sometimes even a few would come back in while they're at college. So we get to watch the kids grow up. I did my training in Mississippi for medical school and residency here in Austin at the Children's Hospital in Austin. So I'm excited to talk about primary care. It's a very important part of our medical community.
Absolutely. Wonderful. So let's just jump right in. Why do you believe primary care is essential for overall community health?
Primary care is the foundation of a healthy medical community. Primary care means that there's a relationship. Well, it doesn't mean there's a relationship, but it is the gatekeeper to accessing care. And so, because of the relationship that primary care allows, it creates much better compliance for patients. It allows the physician to much better understand the patient and what is happening. And so, because of those things, I feel like it drastically improves the medical care of a community to have a um, strong primary care network.
That's great. So, being a primary care physician, what would you say are the most rewarding aspects of your job?
Pediatrics is definitely unique compared to the adult world, but for us, it is watching the kids grow up and getting to know the family and meet their new brothers and sisters. And so just that relationship. But we have the relationship with the children, but we also get the relationship with the parents. So you get to know the whole family. And it is just a privilege to get to watch a family grow. When you see brand new parents before they even have the baby, and they come to visit you when they're pregnant, to they're launching teenagers to college, is quite a delight.
I bet. Absolutely. So rewarding. What challenges do you think you face in your daily practice as a primary care doctor?
Um, with the changing medical care landscape, there have been more and more challenges increasingly over the years. Insurance is probably our biggest headache, unfortunately. There have been decreasing payments. Fortunately, primary care becomes um, less recognized and payments just decrease, yet our costs of care continue to increase. There is more infrastructure required to deal with insurance requirements. And so sometimes we have to have extra staffing just to do what insurance is asking for. So that's just an increased cost in and of itself to even file insurance. Having to get certain authorizations. So there's just an increased workload to even file insurance. So definitely our biggest challenge becomes is that. We also are faced with an increase in urgent care centers, which is helpful. They serve a great purpose, and we're glad to have them. But with our society's desire for convenience and ease, and working families have schedules to deal with, it is a lot easier to go to an urgent care. But it really, we face a challenge in primary care to keep that relationship when sometimes the convenience for urgent care is a lot easier. And sometimes that does fragment and hurt the care that we're trying to provide. It's probably I would say, our second greatest challenge over insurance.
Completely relatable and understandable. So, National Primary Care Week highlights the importance of primary care in improving health outcomes. How do you see this play out in your practice?
Good question. Thanks. Again, pediatrics is unique to the adult world, so it is hard for me to speak to the adult condition. But one of our favorite things to work with parents that has tremendous lifelong benefits is just breastfeeding. We feel like healthy breastfeeding has such health benefits long term. And a primary care relationship goes such a long way to help a struggling mother establish that. So that is very important for us to work with, and we definitely see improved outcomes with that. On that note, it is not always successful. It can be a hard thing. Sometimes it doesn't work or is not what they desire. And so we want to be there to help them navigate alternatives and talk through healthy ways to do that as well. We feel like having a continuous relationship with families helps us improve our antibiotic choices. Being in primary care, there can be a lot of misuse of antibiotics, and you want to make sure that you're using the right antibiotic when it's needed. So we feel like our continual relationship helps improve that health outcome. And then I think one of the biggest things we can provide is avoiding ER visits. They are costly, they're timely, and when we know our patients, if they can get in touch with us, we can see them, talk to them, even if it's after hours. Most of the time, we're able to avoid an ER visit, and that is a huge improved health outcome.
And on the topic of National Primary Care Week, how do you think that helps raise awareness about the importance of the work that you do as a doctor?
We appreciate an awareness, like a public health announcement for this, because I think sometimes people don't think about the importance of going to the same doctor. Why would it matter? This is convenient. This is easy. So to even think through the reasons that a relationship does matter and could improve their health, I think is an excellent public health message that we greatly appreciate. Just understanding that if we know you, we can often make different choices than maybe someone who doesn't know you. The way they decide is differently.
What common health issues do you see in your community, and how do you address them through your work in primary care?
So some of the biggest or the more common health issues in children that our practice takes care of, asthma is one of the big medical diagnoses that we feel like with the continuing relationship we can improve. We will see them periodically when they're healthy and not having flares. And we strongly feel that by doing that, optimizes their medication to decrease the flares. ADHD is another one and is even increasing. And by educating parents of what is common, what's acceptable, when is medication necessary, what are some other alternatives to medication, we are able to talk them through management of that. And that is an ADHD management is helpful too, to have the routine well checks, because we can often help the parents identify when there is an issue that they may not be aware of. So those are two of the common ones to pediatrics that are actually not just preventative, actual medical conditions that we then help with the continuity of relationship.
What trends do you see shaping the future of primary care?
Thank you for asking that, because a lot of the trends that we are seeing, unfortunately, feel like challenges. With back to the urgent care, with the shift to convenience, we feel like medical care becomes very more acute instead of preventative. There are so many studies that just show prevention is so important to improve health outcomes. So primary care is so important for the preventative things. And when you shift to urgent care and convenience, you miss out on that. So the focus on acute care is a trend that we feel like we would really like to see shift back. In order to do that, though, primary care offices are going to have to improve their scheduling. So when you cannot get into your own doctor, you're forced to go to an urgent care. And so it's very important for primary care providers to work hard to accommodate their own patients so that we can keep our own patients in that relationship. To that, there is a trend of physician shortage. Primary care is not as appealing sometimes as some other subspecialties. A lot of times that's based on compensation. So we are struggling to fill physician spots, which then affects the scheduling. So that is also one of the trends that gives us a challenge.
That's very insightful. Absolutely. Thank you for that. And lastly, Dr. Annabelle, what message would you like to share with patients and other healthcare providers during National Primary Care Week?
find your own physician, make an appointment with them to get your annual checkup, and continue to see that same physician as much as you can. I promise you, developing that relationship will be rewarding.
It certainly will be. Well, Dr. Annabelle, thank you so very much for taking the time out of your day to join us here as a guest speaker with Boundless Life Sciences Group. And I wish you continued success in your future in the medical field. And we hope to speak with you again soon. Thank you so much.
Absolutely. Thank you for having me.